Okay, now we have a summary of this Barrett carcinoma of esophagus. Barrett carcinoma means adenocarcinoma. So you find the masses, here the tumor, and here 1, 2, 3, 4, 5 show us this is normal squamous epithelium. This is also normal 5 stomach, and here in the junction we can see this is the Barrett metaplasia, and here is the tumor. So this is the disease of esophagus. Now let's see the disease in the stomach. First, also the inflammatory gastritis. Gastritis is simply defined as inflammation of the gastric mucosa. So it can be divided into acute or the chronic. For the acute, we know for acute inflammation, we usually find the neutrophilic infiltration. And for chronic, we find the lymphocytes or plasma cells predominating. And usually for chronic gastritis, we find intestinal metaplasia and the atrophy of the glands of stomach. And for clinical feature, some are similar as the disease of esophagus, for example, heartburn. And also the gastric pain, the pain, and we'll find this hematemesis and melena. And this picture shows us the normal anatomy of stomach. Different areas have the different glands and the different function. For example, here, the cardia area, cardia glands, they produce the mucosin. And for this fundus area, they will produce this acid, gastric acid. We can find this in the fundus and the body. We can find this parietal cell, chief cell, produce this acid, gastric acid. And we also can find some endocrine cells. And for the rest area, the main function is also produce this mucus. And for the gastritis, the pathogenesis, including these factors. So the chronic gastritis is mainly associated with this bacteria. I think you know this bacteria, HP. This bacteria, we will introduce in details later. And also can be caused by autoimmune. This is the type A gastritis. And the third is toxic. For example, this alcohol, this cigarette smoking. And the fourth is associated with the pressure or the post-surgical this operation, after operation. And the fourth is radiation, and the fifth is about the granulomatous conditions. For example, the Crohn's disease, we also will introduce later. So this is the HP, this kind of bacteria. We can see here the smaller one usually live in the surface of mucosa of stomach. And here, the blue one with ginger staining, we can see this HP. And it can associate, this kind of bacteria can cause many kinds of disease in the stomach. Now let's see here. The associated disease with HP, including chronic gastritis, including the peptic ulcer, including the carcinoma, also including the lymphoma in the stomach. This kind of mucosa-associated lymphoid tissue lymphoma, mouth lymphoma. So for this kind of lymphoma, it's definitive etiologic role for this HP. Now first, let's see the chronic gastritis. Here, this picture shows us this chronic gastritis. From this picture, we can find this is the intestinal metaplasia. Why we say this is intestinal metaplasia, this area? Why we say this is intestinal metaplasia, this area? We find what kind of cells here? What kind of cells? Goblet cells. Usually for the gastric mucosa, we cannot find these cells, goblet cells. These goblet cells is common in the intestinal mucosa. So this is the intestinal metaplasia, this area. And then we also find many chronic inflammatory cells here. This small duct nuclei, this is the lymphocytes and the plasma cells here. And also we can see in this area, the glands are atrophied. And for the chronic gastritis can be divided three types, type A, type B, and type C. Type A is associated with this cytotoxic T cell and antibodies. These antibodies to the epithelia of the stomach. For example, this antibody or the cytotoxic T cell will destroy the normal glands, especially these parietal cells. So the acid, the produce of acid is decreased. The second type is bacterial gastritis. So it's associated with HP, usually HP. And the third is chemical. Some drugs, some alcohol, or the reflux of duodenal gastric. And also others. And we will focus on these three types of chronic gastritis. Type A gastritis, we also call the autoimmune gastritis or the pernicious gastritis. So from this kind of gastritis, it will destroy the glands, the fundus glands. So the several consequences will occur. One is the alkaloidia. This is become the regulatory hyperplasia of intragastric cells. This is one kind of consequence. And the second is the lack of intrinsic factor. So we know for this intrinsic factor is associated with the resorption of vitamin B12. When this kind of factor is lacked, then we will find the anemia, one kind of anemia, microcytic anemia of this patient. This is the picture of type A gastritis. This is acute. And we can see here the glands are destroyed when we, under high magnification, we can see here is the cells are destroyed. The glands are destroyed and the number decreases. So we can see autoreactive CD8 positive T cell. These small cells, when we use immunostaining, we can mark this kind of T cells. So the first type A gastritis, is associated with the immune system. And the type B gastritis is associated with bacteria. So for this HP, this kind of bacteria, it is common. Half of the population in the world infected by HP. That means half of you also infect of this HP. When you check it, the cause they can the HP bacteria can cause this kind of disease. I have mentioned just now gastritic, peptic ulcer, and the tumor. This kind of infect is usually from parents to child to children, from oral to oral, or from feces to oral. This kind of HP always adheres to the gastric type mucosal surface cells. So we only find it in the stomach. It does not exist on intestinal type cell or squamous cells. So in the esophagus and the intestinal, we cannot find this HP. Only in the stomach. They live in these mucosal surface cells, gastric type mucosal surface cells. And it can live lifelong in the host. And it can grow to high density and cause the disease. So the bacteria of HP is detected by Dr. Warren and his student Marshall in 1982. And the article is published in 1983. So in 2005, they won the Nobel Prize in medicine because of this detection of HP. So this picture, what did this picture tell us? This is the glands. This is special staining, Giemsa staining. We also find this HP in the glands, in the surface cell, in the gastric mucosal surface cell. And here is also specific staining. We can see the bacteria. So we have seen this HP bacteria. Let's see the disease associated with HP. It can always cause a chronic active gastritis. What means the chronic active gastritis? For chronic gastritis, we can see the chronic inflammatory cells, lymphoid cells, plasma cells. And when we see in the chronic gastritis, we find this neutrophils, then we say this is active. And 90% of duodenal ulcer associated are caused by this bacteria. 70% of stomach ulcer associated with HP. And it can cause this relative risk of stomach carcinoma 3 to 6 times increased. And when we eradication of HP can elimination of this mild lymphoma. This we have some patient cases when we therapy for this HP, then this kind of lymphoma will decrease, even disappear. The cause of this HP, because of this toxicity, two kinds of, this is the VAC-A, this is the one kind of cytotoxin, and the second, this is the CAGA. This is this contains 29 genes and is secreted by HP and transported into the cell. This kind of toxicity is associated with stronger inflammation, carcinoma, and lymphoma. So these two kinds, we focus on these two kinds of toxicity. The association of HP and the gastric cancer. We have said half of the population infected by HP. And now in the world for each year, 500,000 deaths from this gastric cancer. So there is high risk of this HP and gastric cancer. But we also find about 30% of gastric cancer is not associated with HP. So here, HP detection as screening for gastric cancer would suffer from low sensitivity and extremely low specificity. So we do this HP detection, but it is not used as scanning for the gastric cancer. Here is a picture published in 2005. They find the HP can survive in the gastric juicer in different pH value. When the pH is 6, it can survive for 15 minutes. So it can block pepsin, significantly increase the time of mobility in the gastric juicer. So for the HP, it can live in the deep of the gastric mucin with adhesion to the gastric type mucosa surface. So it can escape the autoimmune system. In the mucins, the HP used the pH concentration gradient for orientation towards to the epithelia and away from the gastric juicer. And we also find the infection of HP is associated with vomiting of siblings. So here, this picture shows us the chronic infection. Here is the HP with Giemsa staining. When they live in the surface of this mucosa, they can escape this immune reaction. The immune reaction cannot eliminate the bacteria in this area, in this special location. So here show us this type B gastritis. We can see here on the surface of this mucosa we find the bacteria HP. And the second, we can see the response, the immune response. We can see many inflammatory cells here. And for 3, this area we find the atrophy of glands, antral glands, this area. And here we find the lymph node. Here is the follicle lymphatic hyperplasia. Many lymph cells consist of this. And this picture shows us the acute gastritis. Here we can see this is the epithelium of stomach, the columnar cells. Here is the mucosine. And in this epithelia, we find this neutrophils infiltrate. So we call it acute. And on the surface, there are many HP. They can produce toxins, so can damage this epithelia. The mucin production reduced. Then it can cause it increase danger of erosion or ulceration.